Can exercise on its own affect prostate cancer? We know that exercise incorporated with a plant-based diet and stress management has a beneficial effect on prostate cancer. But what about exercise on its own? This has now been researched, and here are the results. Patients with recurrence following radical prostatectomy or patients managed on active surveillance were either put in a group doing home exercise endurance training 3 times per week for 24 months, or a control group receiving usual care. The participants in the exercise group showed significant improvements in triglycerides, Adiponectin IGF-1, IGF-BP1, and fasting glucose levels. Adiponectin is a hormone involved in glucose regulation and fatty acid oxidation. IGF-1 is a growth factor, and IGF-BP1 stands for IGF-1 binding protein, which alters IGF-1 interaction with cell receptors. What is especially interesting is that PSADT, PSA doubling time, increased from 28 to 76 months during the first 6 months of exercise. PSADT is a calculated number, and a high value is associated with a reduced risk of disease progression. None of these changes were taking place in the control group. This is good news. Exercise by itself makes a difference. But the smart thing to do is to also incorporate an effective dietary regime as well as stress reduction.